The last question that concerns fish oil, by the way, is to comment on the role of antioxidants and the common ones like vitamin C and vitamin E may not be the first choice now that we know much more about what the typical profile is. And certainly something that biochemistry people still need to tell us about is the natural profile of antioxidants in the body and what happens when you take additional pills on top of those, like SOD, the superoxide dismutase, whether it's the zinc or the manganese and glutathione and so forth. Those things interact with the pills that you take, and I know that, Dave, you wanted especially to discuss that topic.
I get a lot of questions about that. What should I be taking? And this conference has been very instructive for me as well, because recently, through my association with TA Sciences and looking at how supplements might interact with telomerase activators and what the role of supplementation is in some of the pathways that we've identified as truly conserved throughout species, throughout time, as very, very genetically important and present in us as well as fruit flies, such as the mTOR pathway. One of the things that you come up with is that glutathione becomes a very, very important and underutilized antioxidant. And the problems have been with bioavailability. N-acetylcysteine, all of you who are clinicians are familiar with that from Tylenol overdosage. That's been what's been available to be useful, and there are some studies that support its use. But obviously the endpoint is glutathione. The mTOR pathway, as I understand it, exists to conserve specifically proteins, helps to recycle sick, dead, and dying cells in mitochondria, and releases two very important amino acids that are the precursors for glutathione. So now and the sirtuin pathway actually feeds into this via a different method. So there's a lot of fascinating cross ties that comes up to point to some simple things that we could potentially do. Now that I've heard about the protected glutathione that gets past some of the usual digestion issues, I'm very fascinated to see that, because I would put that in my top 5. The other things, obviously, fish oil, a huge proponent of fish oil. We talk about longevity, and we talk about the bridges to longevity. If we could increase the population in this country's fish oil intake 4-fold, we would reduce cardiac deaths by approximately 200,000 a year. We would save, I don't know how many billion, I think it's $40 billion a year. Now, that may not make people live longer, because I happen to know that fish oil is not a telomerase activator, and it's probably also not a telomerase inhibitor, by the way, unless you have cancer. But the bottom line is there's enormous population-based studies, not mouse-based, not Drosophila-based, but population-based studies that have looked at omega-3 fatty acid composition. And essentially, the closer you get to 4-to-1, or better yet, 1-to-1 of omega-3s versus the inflammatory omega-6s, the longer you live, the less you die of heart disease, the less you die of cancer, the less arthritis you get, and the less Alzheimer's you get. So my vote, fish oil, glutathione, obviously I'd like to see an anthocyanidin, a multivite, etc. But those two really shine, and they shine not only in terms of science, but they shine in terms of what happens when you give them to patients. They come back and they say feel better. I'm so glad I didn't have to take that anti-inflammatory, because I'm so scared of what happened with Vioxx, Celebrex, and Bextra. And now you can give them a high-dose fish oil and they can feel better, and they can get over some of their pain. So there is some real science to this. A lot of times supplements are looked on as just, oh, this just creates expensive urine. I need to acknowledge Steve's comment very quickly. He's absolutely right. When you take things that are antioxidants and you put them in your body, if your body is healthy, you may actually displace or interfere with the metabolism of those antioxidants. But the truth be told, again, using fish oil as a classic example, if you look at EPA ratios, DHA ratios on red blood cells, what you find is that the average American is floating around 16-to-1 pro-inflammatory versus anti-inflammatory. So there's some real science behind all this, and those two are absolutely critical. And it's why doesn't the science show the benefit of antioxidant therapy? I can give you 3 reasons. Number 1, they use the wrong antioxidants. Number 2, they time them at the wrong time. And number 3, they don't want to, because there's drugs out there they're trying to sell you.
All great points. I'd just like to make some refinements and because the devil's in the details. And I'm a big proponent of fish oils. I've been promoting them a long time, but it's actually more specifically the animal-based omega-3 fats, the DHA and the EPA. Fish oil, folks, is not sustainable in this world. There is not enough fish to go around. Nearly all the fish are contaminated. There's enormous amounts of processing. I do not advocate fish oil. I advocate krill oil, which has phospholipids, which improve the absorption, and also have astaxanthin, which is a very powerful antioxidant, which prevents the peroxidation of the lipids. So that's what I use. I'm not, and it is totally sustainable. There's enough krill oil in the world to go around several fold for every person on the planet. The other component is glutathione, which I think is phenomenal. First of all, let me say that I'm prejudiced. I do not advocate supplements normally. I don't. I think you should get it from the food. And with glutathione, I'm really concerned about glutathione supplements, and I'm just going to publish a paper next week on the site regarding the use of high-quality whey protein, ideally obtained from raw milk, which you have in California, raw organic milk, but you can also get it from raw organic grass-fed cows. It is very specially processed type of whey protein, which has the critical amino acids that are the precursors, and it can actually increase glutathione levels just as much. And I've actually shared correspondence with this with Dave over the last few days. We kind of agreed to disagree on that, but I think there probably is a place for glutathione in fit people.
So I just wanted to make one comment. We actually do agree.
Yeah.
Whey protein for healthy people and young people is probably the better way to go. Most of us are not young and most of us are not healthy, especially the people that are coming to see anti-aging docs, because the cells actually use up a lot of energy, a lot of ATP in processing the precursors, and they further weaken the cells that are already weak. So I think both arguments, depending on the audience you're speaking to.
Okay. So good points on that, but there's other ways for glutathione other than that was the main issue. With respect to other antioxidants, I happen to like ubiquinol, which is CoQ10. It's a reduced version. It's about 3 to 4 times more expensive, but as you age and you get over 40 years old, your ability to make that reduction is reduced. And coenzyme Q10 is made by the liver. It actually is destroyed if you take a statin drug. I think it's absolutely beyond ludicrous for anyone, virtually anyone. There's probably 1 in 1,000 people who need to be on a statin drug, which is people who have familial hypercholesterolemia, but virtually everyone else does not need to be on them. And if you are, you knock out your CoQ10, so you have to go on a CoQ10 supplement. And there's a lot of research that really, at least in animal studies, show amazing longevity with ubiquinol. And it also tends to recycle the other antioxidants as vitamin E and vitamin C because they don't work if they're not reduced, and this helps reduce them and to let them work further. Additionally, I think it really all depends. As I mentioned, it could be by theory and science the best supplement in the world, undisputed research for everyone, but unless it's good for you specifically with your unique biochemistry and genetics, it's not going to work. And depending on what other supplements, what other diseases you have, what your diet is, it could make you worse. So I think the big point here is to have it measured, have it tested for you specifically individually. And there's not a blood test. It has to be an energetic test. Otherwise, and I have mine tested every 2 weeks, and they change. Sometimes you have to go off of ubiquinol, sometimes I double the dose. And it really depends on what's going on in your life.
Real quick, we agree to disagree on krill. The only point I would make on that is that there are over 10,000 studies on PubMed that you can look up that are specifically using fish oil. Krill seems to come from the University of Guelph in Ontario, which is pretty close to where the company that makes it is located. So I'm a little suspicious of that.
No, it's harvested in the Antarctic.
No, I know that, but I'm the manufacturer of the krill, the people who actually make it and encapsulate it. Anyway, we don't want to get into an argument about that here, but we'll debate that in a bit. But the other thing is, and this is to take up Dave's point about amino acids. Joe is absolutely right. Amino acids are specifically leucine and asparagine are the precursors of glutathione. The only question, and this is probably a theoretical question rather than a real question, but I mention it because it is in the literature, is the anabolic effect of whey proteins and their effect on smooth muscle and how that might impact on the health of older individuals with urethritis. No, I think it's positive.
Oh, it's good.
Yes, absolutely, but it might grow.
I'm a real advocate of antioxidants, but once again, here's the problem that we get into when we have all these discussions. And we do this in medicine. Well, high blood pressure is bad for you, therefore low blood pressure is good for you. Everything's optimal. I think the body is way smarter than we think it is. And I think that there are zones where you need high antioxidant potential, and there are zones where you want low antioxidant potential. If you have a bacteria, the zone surrounding your white blood cells, you want that to be real high oxidative, not antioxidative. Around your DNA, you want that to be low oxidative. So there's certain areas in the lung where you want high oxidation, certain areas in the mitochondria. And even within the mitochondria, we say that there's certain areas where it's producing, spinning off all this ATP, but then it's creating free radicals. We are going to become more sophisticated as time goes on. Medicine is always in process. We never have all the answers. We don't have all the answers today.